Yeah, right now people have a lot of questions about coronavirus, and one of the things about coronavirus that people need to be aware of, it's a virus that's very similar to the influenza type virus, but it's a new virus that we don't have any vaccines for, and people are getting problems with, mostly the elderly people, and most of the time the elderly people are the ones getting affected the most. The kids are maybe getting it and passing it along without even getting as sick as the elderly people. And one of the reasons why the elderly people get sick is because their immune system is not as strong, so there's really no treatment for coronavirus, especially now. So the main ways to control it is to prevent any exposure. So if you don't have to travel, go to an area where there's a lot of people, especially airports or concerts or big restaurants and meetings. As a matter of fact, I know a lot of conferences and meetings have been canceled here in Florida, especially around this time of the year, which is spring break, which I know is a big deal for the economy of Florida. But it is very concerning, to be around large groups of people, especially if you have an issue with a compromised immune system, especially things like lupus, rheumatoid arthritis, any kind of autoimmune disease, Crohn's. You're definitely at high risk. So since there's really no therapy for it, the main things to watch out for is early detection through symptoms. If you have like scratchy throat, fever, and mostly respiratory type symptoms like cough, shortness of breath, or pneumonia is the ultimate problem there. So those are the things that if you develop anything like that, or you've had an exposure, you need to get tested. And generally you have to check with your local hospital. I know some of the local hospitals now have testing kits, but most of the testing kits you can find at the health department and get tested. And if you do show up as having possibly that or positive for the coronavirus, which is, it's a swab, it's a PCR sort of DNA test, oropharyngeal, so like in your mouth or nasal cavities, and if that comes up positive, then you have to be quarantined for 2 weeks so you don't expose somebody else, and make sure that you take the proper measures. But the main thing to do is to boost your immune system, and one of the best things to do is IV infusions. I think right now are very big. IV vitamin C and glutathione. Glutathione is a master antioxidant. We make it in our body, but sometimes it gets depleted due to us having a lot of issues with toxins and infections and other things. So those are always ways to boost your immune system.